Good afternoon, everyone. Craig Kiger, Minnesota DNR Outreach, and today's show is number 204, TikTok. And we are going to have a speaker from Minnesota DNR, Ashley Erkey, to walk us through. Um, Remember, if you need any of the closed captioning service, they're down in the bottom right corner under the ellipses. So with that, Ashley, tell us a little bit about yourself and what you do.
Hi, I'm Ashley Erkey. I'm a safety administrator with the DNR. I'm actually, there's 4 of us with the DNR, and I'm for the central region. So I cover the metro all the way up towards St. Cloud and Little Falls, all the way down to our southeastern corner of the state. And I focus on employee safety as well as visitor safety, public safety for our DNR locations. So today I will be talking about ticks. We call it TikTok. So we're going to be focusing on identification and prevention strategies, as well as tick-borne diseases. So we're going to cover these 3 topics moving forward, and I'll jump right into it. So ticks are closely related to mites and spiders. They do have 4 stages, life stages. There's the egg, a larva, a nymph, and adult. All the stages except for the egg stage do require a blood feed for energy and to grow and reproduce. Peak activity for adults is spring, so think March and April, as we are in that time frame already, as well as in the fall, so October through December. Larval stages are most active from August through September, and the nymph stage are most active through June and July. But really, ticks can be active any time of the year as long as the temperatures are above freezing. So within the DNR, we can get tick exposure, December, January, February. It's not completely uncommon. It's has happened. A unfed tick will appear flattened and teardrop in shaped, while once a adult tick or even a nymph tick has a feed, it's more difficult to identify because their abdomen swells. So some of the identification markers are a little harder to see. Adult females are always larger than the males, and I'll show that on the next few slides as well. Here in Minnesota, we have 13 different tick species, but for today's purposes and for time, we are only going to cover 3 that are of main concern that have been known to transmit diseases. So the blacklegged tick, the American dog tick, and the Lone Star tick. So the first one we're going to touch on today is the blacklegged tick, commonly known as the deer tick. And reason why that is, their main reproductive host is the white-tailed deer. So that's where they get their nickname for deer tick. Blacklegged ticks do have a life cycle that take a full 2 years to complete, larva in 1 year, and nymph in adults in the 2nd year. So here's a larva on the top corner here, and here's the nymph stage. And as you can see, right here on the right side is the adult female. She is slightly larger than the adult male, but their distribution range is very similar to wherever you can find white-tailed deer. So they can be found in forests, tall grasslands, shrubs along forest edges. They do like high humidity and moist areas. So for transmitting tick-borne diseases, the nymph stage and the adult stage are going to be the known ones to transmit. Common diseases that you can get from the blackleg tick include the hard tick relapsing fever, human anaplasmosis. Oh, I'm tongue twisted this afternoon. Anaplasmosis, human babiosis, Lyme disease, and Powassan virus. And I'll touch on a few of those a little bit later as well. So the American dog tick, we commonly refer to it as a wood tick. It is the most common tick species here in North America. They can be found in grassy fields, shrubland, forest edges, and areas with little to no tree cover. They do require a 3-stage host life cycle, and they can survive up to 2 years at any given stage if a host is not found. Um, Adults are the most common to use humans and pets, so including cats and dogs, for hosts, while the larva and nymph stages will typically use small rodents, so mice, rabbits, squirrels, things like that. The American dog tick is known for transmitting Rocky Mountain spotted fever and excuse me, tularemia. And the last one we're going to touch on today is the Lone Star tick. Um, this one can be found in woodlands with dense undergrowth and around animal resting areas. They can be very aggressive towards humans. They tend to be what they consider aggressive human biters. The larva stage is not known to carry any tick-borne diseases, but the nymph and adults do with the Lone Star tick. They've been the most one that you probably heard about the most recently that's gotten a lot of attention is the southern tick associated rash illness. This is the one that causes the red meat allergy that some people have developed after being bitten by a Lone Star tick. But they can also transmit Rocky Mountain spotted fever, um, excuse me, I'm having a hard time with this one today, tularemia, and then ehrlichiosis. So what we'll talk about next is some of these tick-borne diseases in particular, some of the symptoms, how long does a tick need to be attached, embedded, before they can transmit some of these tick-borne diseases to a human. So we'll touch about that next here. But what you'll find as we talk about these tick-borne diseases is that many of the symptoms are very similar to common illnesses such as a cold and influenza. So following up with your doctor will be the best option to rule out any potential tick-borne disease infection. So the first one I'm going to talk about today in particular is Lyme disease. So it was first discovered in Lyme, Connecticut, where it got its name in 1975. It is the most common tick-borne illness across Minnesota and in the United States. It is a serious bacterial infection that can infect both humans and animals. This does include your pets, dogs and cats. It is transmitted through a bite from a black-legged tick that has been attached for at least 24 to 48 hours. Not every single black-legged tick can carry the bacteria that spreads the disease. Early symptoms can appear within the first month following a tick bite. Sometimes the bite site will appear as a red, swollen bullseye appearance, but other symptoms might include chills, fever, muscle and joint pain, tiredness or weakness, and that you may not have all of these symptoms. You may have one or several, and like I mentioned before, they can take up to a month or even longer to develop. Each individual is different. If treatment is not received in early stages, other symptoms may develop further down the line, such as rashes. You may have weakness or numbness in the limbs, swelling in one or more possible joints, and an irregular heartbeat, as well as paralysis on a side of the face. You do need a medical professional or a doctor to diagnose Lyme disease. And then they usually base it on the history of exposure to tick habitat. If you know you've had an embedded tick, and let's say you bring that with you to the physical examination, and then also laboratory tests. Treatment for Lyme disease does include antibiotics, and then it could take longer and multiple treatments depending on when diagnosis occurs. With Lyme disease, it is a tick-borne disease that you can get multiple times. So just because you get it once doesn't mean you're immune to it moving forward. You can get reinfected. So babiosis, or excuse me, anaplasmosis is a bacterial disease as well. that is transmitted by blackleg ticks is the second most common tick-borne disease in Minnesota. Just like Lyme disease, not all blackleg ticks can carry the bacteria, and not every single bite can cause an infection. The tick must be attached to you for 12 to 24 hours before the bacteria can spread. Many individuals who do get infected have no symptoms or have very mild symptoms. So usually they'll appear within 1 or 2 weeks of the tick bite. And common symptoms with this infection does include a fever, headache, muscle aches, nausea, or even abdominal pain. You do need to be diagnosed through a medical professional, and then treatment is with standard antibiotics. Just like Lyme disease, you can get anaplasmosis more than once. Babiosis is another infection. It is less common in Minnesota, but there is increased rates. It is a microscopic parasite, so it is not a bacterial infection like the previous ones we've talked about, but it is a parasite that can be found on blackleg ticks. Not every single tick does carry the parasite, and not everyone who gets bit can get this infection. But the tick must be attached for at least 24 hours for the parasite to spread over to us. Many individuals that with the parasite might not have no symptoms or have very mild symptoms. So very similar to anaplasmosis, you might have a fever, headache, muscle aches, tiredness, weakness. It may take up to several weeks for these symptoms to develop. You do need diagnosis through a medical professional, and they'll take into consideration if you've been exposed to tick habitat. They might provide laboratory tests and physical examination. But treatment is only really required for those who do develop symptoms, and they will include several different combinations of medications and supportive care. So some other known tick-borne diseases here in Minnesota that are not as common as the ones we previously mentioned, but there is cases occasionally. Powassan virus disease is a tick-borne flavivirus. It's like a mosquito-borne illness similar to like a West Nile virus. It can spread through a bite of an infected blackleg tick. Symptoms can appear 1 to 4 weeks after the tick bite. Symptoms do include fever, headache, vomiting, weakness, seizures, encephalitis, meningitis, and long-term neurological symptoms are possible from a severe disease infection. There is no specific treatment for this disease, so supportive care and early diagnosis is key. Ehrlichiosis is a bacterial infection that can be spread through 2 different types of ticks, the blackleg tick as well as the lone star tick. There's actually several different bacterial strands. So this is just kind of like an overarching name for the bacteria that can be spread from these ticks. It is very common in the southern states of the United States. However, Minnesota, we do get a few cases here in Minnesota. Symptoms do include fever, headache, muscle aches, and a low number of, so anemia as well. Antibiotics are the standard treatment because this is a bacterial infection. This is one of the tick-borne diseases that is also common in pets. Rocky Mountain spotted fever is a bacterial disease that is transmitted through American dog ticks. Symptoms do include abrupt onset of fever, malaise, headache, muscle aches, loss of appetite, nausea, vomiting, and a rash. This rash can often appear 2 to 5 days after the onset of fever. And this is one of the more severe tick-borne diseases because it can result into organ failure and death if it's not treated early on. So treatment should really be started as soon as this is suspected, and we'll start with different types of antibiotics and supportive care. So the last two we'll touch on here, tularemia might also be known as rabbit fever disease. It's very common in small rodents like rabbits. It is in squirrels as well. It is a bacterial infection that can infect us as well as our pets. But the American dog tick can also transmit this disease. Symptoms do include a fever, chills, swollen lymph nodes, skin or mouth ulcers, muscle aches, joint pain. Because this is a bacterial infection, it can be treated with antibiotics. And the last one we'll touch on is tick relapsing fever. There is several different kinds. They're usually referred to as soft or hard, depending on the type of tick that transmitted. But in our cases, for the black-legged tick, this would be a hard tick relapsing fever. There has been a few cases in the state in the past decade. Common symptoms do include fever, chills, muscle and joint pain, headaches, and rash. Later stages of infection do include arthritis-like symptoms, and antibiotics are used for treatment. So as we touched on each of these tick-borne diseases very, very briefly, you can see that many of the symptoms are very similar across each of the tick-borne diseases, and they can mimic symptoms of the common illnesses such as the cold, the influenza, even COVID-19 nowadays. So early diagnosis is key to get proper treatment and supportive care. And we'll show you how preventing tick bites can help prevent these tick-borne illnesses and hopefully, excuse me, reduce your risk of obtaining a tick-borne disease, which we'll touch on here next. So one of the best forms of protection and prevention is Permethrin clothing to do commercially treated outfits, so that shirts, both long or short sleeves, pants, and shorts and socks. There are options to buy pre-treated clothing. They're available at most outdoor clothing stores, online. Insect Shield is a common commercial vendor for these types of Permethrin treated clothing. But you can also use a spray for your shoes and other small pieces of clothing, which would be available. You can also send in your clothing to be treated. So very similar to just buying it pre-treated, by sending in your clothes to be commercially treated. It actually extends the life of the treatment to about 70 washes, depending on the type of clothing you send in. It's advised not to send in dry clothing only, or no trouble dry items. So, you know, things that are good to throw in the wash and dryer at normal wash and dry, those are the items you'd want to send in to get treated to have that extended life. And like I already mentioned, you can pre-treat your own with spray or wash-in treatment. I personally have done the wash-in treatment. It works pretty well and is relatively low cost. This is not as effective as the commercially treated, but for, you know, smaller uses, like if you're doing outdoor trips, camping trips, things like that, you know, doing your own wash is an option. It is important to make sure that you give time for your clothing and other accessories, time to dry for the permethrin to be effective. So some significant facts about permethrin treated clothing. It is effective in repelling mosquitoes, ticks, ants, and biting flies, chiggers, and midges, not just ticks alone. Typically, especially when it is commercially treated clothing, it does not require reapplication. So it's not something you have to keep spraying on yourself while in the field. You don't have to worry about that. You know, if you're out for a day or a week, you don't have to worry. Once it's on the clothing, there's no exposure to it, so no potential for it to be swallowed, no potential for overuse. It's not harmful to the eyes, and the entire family can use this really with no restriction. So it is safe for individuals that are pregnant or nursing, as well as infants, toddlers, and children. It is easy care, normal laundering at home is recommended, so you can just throw it in the wash, do normal dry to get that lifetime of the 70+ washes. it is just advised not to do a dry clean. Doing dry cleaning will actually kind of remove the product directly from the treated clothing. So self-treated Permethrin treated clothing is not as effective as the commercially, like we just mentioned. Sweating and water exposure does not significantly deteriorate the application. Washing will slowly remove it, but you can still get a little bit longer of life. Dry cleaning completely removes it. You do want to follow the application directions. Depending on the type of product you use, typically uses around 3 ounces per garment. And then you want to make sure you store your treated clothing in dark places, a plastic bag or dark room or something like that when not in use to increase longevity, because UV and sunlight does deteriorate the product over time. So besides treated clothing options, other forms of protection include sealing your clothes. So you really want to make sure you seal at the entrance of where ticks can get through. So usually around the sleeves and the ankles. So tick gaiters are a thing. You can put those on to help seal in and your pants and your shoes to help prevent ticks from crawling up your down your socks or up your pants. You can also tuck your pants into the gaiters, as well as seal your wrists and pants. So main thing is you just want to make sure you have a tight seal at these entry points for the ticks, kind of eliminate what routes of options they have to get directly to your skin. Other forms of protection include repellents. Make sure you use them as they are to be used. So what the directions say, make sure you expose them as often as they require. So there are other ones that do help with tick protection. They just usually require repetitive or more often to just require more often to be applied to you directly. As well as when you do use sunscreen with any type of repellent, make sure you put the sunscreen on first and then the repellent on top. By putting the sunscreen on last, you kind of diminish the effectiveness of the repellent. For any additional skin applied repellents, the EPA has a search tool for you. So the main focus is going to be mosquitoes or ticks or both. You can use this website here to help determine like how often it needs to be applied, what are the active ingredients. If you want something a little bit more on the natural side or stronger side, they will tell you that product manufacturer and what the actual protection is for either mosquitoes or ticks. It is very important that you pay attention to the product's protection time. Some repellents do only last 1 or 2 hours, so they would require reapplication often to make sure you have the actual protection that the product guarantees. Some best practices that we use here commonly in the DNR is just using light colored clothing. This helps see the ticks better. You can see them a little bit better crawling around on you, spot them, and then you can help pick them off your clothing before they have the opportunity to get to your skin and bite you. As well as wearing long sleeves over short sleeves. That eliminates the surface area that they can get to directly to your skin. Try not wearing button down shirts. That opens up gaps and leaves options for them to crawl through to get to your skin. And wearing a hat to help keep your scalp covered and less area, like I mentioned, for the ticks to crawl and directly access your skin. But one of the main things is to always inspect yourself as often as you can before entering your vehicle or returning to your office or anytime you change clothes, especially if you have been in tick habitat. And nowadays, depending where you are, that could be your backyard, it could be your favorite walking trail or your state park or your hunting site. So the main thing is try to inspect yourself regularly. And that does include your pets as well. Pets do offer a route for ticks to get to us. So if ticks are coming in and out of your home, please make sure to also include them on the inspection regularly. It's not always easy to inspect or spot a tick on yourself. Adult ticks are about the size of a sesame seed, when the nymphs are even smaller, about the size of a poppy seed, and could potentially be smaller. So very similar to like a freckle on the skin. So make sure you just do a very thorough check over your entire body. Make sure if you are able to, you can ask a loved one to help search or use mirrors to help investigate some of those hard to see places, especially like on your back. Don't forget to look in your hair or behind your ears, in your ears even, and in your belly button, behind your knee. Those are all places that are commonly found where you can find ticks that you may not normally look or are hard to see. So the main thing is you want to make sure after you do inspect yourself, if you have the option to shower and towel off vigorously, sometimes even when you do the inspection, you'll miss it, but you'll find it after you shower. So that's always another preventive strategy to take well after inspecting yourself. For most people that I've known have contracted a tick-borne illness, they didn't even know they were bitten in the first place. So taking the time to inspect regularly, including your pets, can help remove some of the ticks off you before they have a chance to even bite you. So some additional protective measures. Treat your pets. There's a lot of over-the-counter or even prescriptions through your veterinarian that can, different types of products that can be utilized. It is important to note that permethrin is not a safe product for cats, cannot be exposed to them when it is wet. They can be around dried, treated clothing, however. So that is something to make note of when using the product. They do make Permethrin car seat covers to help with vehicles. You can always bag your clothing to not contaminate your vehicle. So if you're coming out from a walking trail or a hunting site or camping trip, you can bag a lot of your outer clothing just seal it up tight, put it in the trunk to help limit some of the potential for ticks to transfer through your vehicle and onto you. Lint rollers are always an option to use, especially for the nymph stage. If you happen to come across kind of a tick bomb where there's a bunch of ticks crawling around ready to quest while they're questing, a lint roller does work really well to get a lot of them off very quickly. And once you're home, you can always put your clothes directly into the dryer on high heat for 10 minutes to help kill any of the ticks in there. Obviously, the biggest prevention and protective measures to try to avoid tick habitat. That's not always an option, but if you are able to do so, especially if you don't have other means of protection available, is to try to avoid that tick habitat when possible. So what happens if you find a tick and it's embedded? So the best option to remove a tick is to use a fine-tipped tweezer. You want to get close to the skin, grip the tick, and pull upwards. Try not to twist. By twisting, you can actually, it's kind of like, you can actually do more damage than good. So squeezing too hard, it can kind of push some of the germs. So while they're sucking your blood, they're actually exchanging germs with them from their mouth to your skin and your blood. So by pulling directly up, you can help minimize some of that squeezing. And then once it is removed, please wash your hands the best you can and clean the bite site immediately with soap and water. And if you don't have soap and water available, rubbing alcohol or even hand sanitizer until you're able to do so. Other tick removal methods, I'm sure we've all heard of some of them, you know, using a hot match, Vaseline. I've heard nail polish remover before. They're not really as effective. The main thing is just using that fine-tipped tweezer to get as close to the skin and pull directly up to hopefully get the head and mouth out as well. So we all heard about crushing the tick after removal as well. Very common, so it can't bite or crawl around anymore afterwards. One of the best things to do is just to place it in a sealable bag, a plastic little sandwich bag, or even a little container that can be completely sealed. So if you had found it on you, it was embedded, and you removed it, you do have the tick in question should you ever develop symptoms down the road. So your healthcare provider can help you identify what type of tick it is and kind of narrow down what type of tick-borne illnesses might be present or you could have been exposed to. If you're spending time outdoors, prepare a tick aid first aid prevention kit. So this would include just having a insect repellent and tweezers on hand, as well as like I mentioned, like even the little sandwich bag or the vial to kind of hold that tick if you ever need to bring it in for question with your medical professional. And the main thing after removing an embedded tick is to just monitor yourself or a loved one for any signs and symptoms that might pop up. And that can average from a day to a week. On average, it is usually a week for a tick-borne illness for someone to start beginning to get some symptoms. And like I already mentioned, these symptoms of these tick-borne illnesses are very similar to the common influenza. Headache, fatigue, rash, they can all mimic other types of illnesses. So it is important to kind of pay attention following a removal of a tick to see if these types of symptoms do develop. And then also it is important to note that not everyone develops the bullseye rash that's often associated with Lyme disease. It may not be even visible. So what happens with Lyme disease, you might get that bullseye rash on a different organ that's internal to your body. So your skin is an organ. If it's not on your skin and it's not visible, it may show up in another organ that you might not be able to see. And not everyone that gets Lyme disease does have the rash. So there's about 40% that doesn't develop the rash. So that's something else to keep in mind, especially with Lyme disease, as it is the most common tick-borne illness. But the main thing is to take precaution, protect yourself from tick bites. If you are outside in tick habitat, whether through employment or recreationally, just try to do as much as you can to prevent tick bites through some of these prevention strategies that we mentioned. If you do find a tick on you, just stay calm, remove it before it has a chance to bite, and if it is embedded, go through those steps with the fine tweezer, remove it, and keep it in a plastic bag in case you do develop any symptoms. So you and your physician can identify any potential tick-borne diseases that could have developed. So just a brief summary of everything we touched about. You know, here in Minnesota, we do have 13 species of tick. There's 3 that are of main concern that are most known for tick-borne illnesses. Those are the black-legged tick, the American dog tick, and the Lone Star tick. The use of Permethrin is the most common, most easiest option for prevention strategies. It does kill the tick. There's different ways you can do that through commercially treated clothing, treating it yourself, or repellents as well. Just make sure you always inspect yourself when you've been in tick habitat, including, you know, make sure you inspect your pets. They are important too because they can get some of these tick-borne illnesses as well. And then also, you know, consider using light-colored clothing so you can better see the ticks when you're outside and remove them before they can attach to you. And then you can leg seals, wrist seals, kind of make sure the clothing is tight at those entry points to help minimize those routes directly to your skin for those ticks. Most importantly, ticks do carry diseases that we can get. If you do end up having a tick bite or have been in tick habitat and did not find a tick on yourself, but you do develop symptoms shortly after, or even up to a month or more after, please remember to get yourself checked out by a medical profession. Let them know you've been in tick habitat, because many of these symptoms are similar to other illnesses, but they do need to be addressed if they're diagnosed correctly. All right, these are some resources that we utilize in the Department of Natural Resources. They're all great additional information. A lot of it goes into more depth of what I covered today. I believe these are shared with you in the chat. And that is all I have for today on our TikTok identification and prevention. And I believe we'll open it up for a Q&A.
Awesome job, Ashley. I have been feeling the creepy crawly all over my body. So we've got quite a few questions, and you did a good job answering the first couple in there. You talked about tulimaria, and that came in just, you were talking about it, and the question had come in just before that. You talked about the best way to remove a tick. And so we're going to jump down to Mary's question. There was a vaccine about 20 years ago, and you know any work that's being done on current vaccines?
I personally do not, but I'm sure that is something our public health partners over at the Department of Health Services could help address, and that's something we can follow up on.
Welcome, Joey.
Hi, good afternoon. I can give a little bit more background. Yep, there was a vaccine that was developed, but it was discontinued in 2022 or 2002. Too many side effects. There are current trials going on for a vaccination for Lyme's disease for humans, but there is just nothing right now. And that's why it's so important to look at prevention and what we can do to prevent the disease in the first place.
How do the chemicals repel the ticks? Jason wants to know.
So it depends on the repellent and the active ingredient. Some of them are just deterrents with permethrin. Directly, it does kill it over a period of time. So it will be on your skin, crawling around, get exposed to the chemical, and then it'll eventually die off, usually before it has a chance to really attach to you. But other repellents, usually it's a type of chemical or essential product that will just deter the tick.
Okay. Looks like Maya wants to know, did you say the insect shield is a brand name of commercially permethrin treated clothing?
Yes, it is a commercial brand that offers clothing that you can usually find either online or in store at usually your outdoor recreational vendors.
Okay. Stephen wants to know how, or Stefan wants to know how permethrin works. Does it work on the animal system, or does it kill them from touching your clothing?
So Joni might be able to answer this one a little bit more directly, but like I kind of mentioned already, once exposed, it does eventually kill the tick, not immediately, but over that period of time, once it is exposed to the product.
It's a neurotoxin. So
Okay.
as the bugs or the insects get exposed to the neurotoxin, it kills their brain slowly over time.
Good.
So it's not an immediate, a tick isn't going to crawl onto your permethrin treated pants and immediately fall off. It's going to get disorientated. It's going to get confused first, and then it's going to die. So, but it affects their brain.
Good. Julia wants to know, do ticks crawl up from ground level, or can they also drop onto you from branches above?
Most common is going to be towards the ground or, lower levels. So think of your knee height or lower. That's just because of where the females lay their eggs, where they hatch. And when the term is called questing, they go search for the host. They usually will climb up, small vegetation where they can then hang off of a leaf or a small branch to when some animal or a host or human walks by, they can attach and then begin crawling up. That's not to say that they can't, you can't get one from a height level. That's not, it's just more common for it to be from more of the ground level.
Okay, Shane wants to know if I'm out in an area with lots of pollinators, how much risk is there for them if they land near permethrin treated clothing?
That is a good question. And it does affect pollinators. So the neurotoxin can kill pollinators as well. So we have this issue in the DNR. We do have a lot of people that work with pollinators, and that's why we have multiple different options for protection. So if you can't use the permethrin because you don't want to kill the pollinators, then you can use the other three forms. So the EPA does have natural repellents. Again, that may have to be reapplied every 20 minutes. You can use the sealing or the barrier method to prevent them from you. The most important thing is to do that tick check and to check for them as soon as you get in from the outdoor environment. It does take that 24-hour time period for that disease transfer to take place. So if you come in from the woods right away and can get them off of you before that disease has a chance to transfer, you significantly lower your risk. So unfortunately, there's not a lot that we can use permethrin with pollinators, but there are other options. So
good. And I think you covered this in your presentation, but Jesse wants to know how long does it take in the dryer for heat to kill ticks on clothing? And I use these same techniques to keep chiggers off of my skin too. Do chiggers carry any disease?
I am not familiar if chiggers carry disease, but for the dryer, a minimum of 10 minutes on high heat. And that's, a very common practice for a lot of other types of, just kill off anything that might be on your clothing. It's just that minimum of 10 minutes and make sure it's on high heat, not regular or low heat.
Okay. And John had basically the same question, but what temperature is needed? And you mentioned a hot dryer, but it's high heat.
High heat. Yeah, most dryers, you have the option nowadays to, change the heat level.
Okay. Laura wants to know, does the heat treated clothing or treated skin have any potential harm other than insects if they land on you, or to harm other insects if they land on you? So you mentioned pollinators could be affected, but are there any insects that could be affected by it? Deer flies, horse flies, that kind of stuff?
Not that we've seen. I mean, if you can find a repellent for deer flies, and horse flies, let me know.
Mm-hmm.
But
and the main thing, depending what product you're using, you can always utilize that EPA tool to help kind of give that additional information.
Okay, good. John wants to know how many people get Lyme's disease each year in Minnesota.
I don't have that number offhand, but it is the #1 tick-borne illness in Minnesota and pretty much the United States. So, sorry, Joni.
The Minnesota Department of Health tracks that too. We can tell you how many we have in DNR and how many tick bite claims we can report in DNR, but for the entire state of Minnesota, Minnesota Department of Health actually checks that. And on the resource page and the last page of the PowerPoint, there's a link for MDH right to their tick page. So they'll be able to get you all of that information and also to find out if there are diseases that you can get from chiggers. I don't know the answer to that one either, but they probably will.
Cindy's question is, I've found it convenient to put the removed ticks on a piece of Scotch tape to immobilize them, and then put that into a plastic bag, especially helpful if multiple ticks. And I got a buddy that's a tick magnet. I think he had 40 or 50 on him in one outing. It's like, oh man, you get right in the back of the truck. Let's see here.
That is a good technique with the tape.
Lindsay said my dog gets a Lyme disease vaccine. How far away are we from vaccinating human beings? And I think Joni covered that a little bit. Beth says, where can I get my clothes treated with Permethrin? You mentioned there's companies that do this.
Yeah, so Insect Shield was one of the commercial vendors that we mentioned, but a simple Google search can give you options of what is available, near your home or where you can send in your clothing to have that done. We do use a vendor through the DNR where our employees can do that directly for their employee uniform and work clothes.
Steve said you didn't really mention or touch on alpha-gal syndrome. Minnesota is a state that has a growing high incident rate. Any info?
I don't have any info of that. The ones I covered today are going to be the more higher rate tick-borne illnesses. So that one was just lower on the list, and due to time, we just didn't touch on that one.
Okay. Laura's come back. She said, does the treatment of clothing or treated skin have the potential to harm other beneficial insects? I think we covered that good.
Mm-hmm.
Let's see here. Jason says disrupting the nervous system of insects, leading to muscle spasm, paralysis, and ultimately death by interfering with sodium channels and causing nerve signals to malfunction. So I think that goes along with what Joni talked about. Can you spray your dog with Permethrin? Stephen wants to know.
I would see if there is a product specifically for pets, and then review what the product, sheet actually says the directions. I have not personally. I do know they do over-the-counter tick prevention products for dogs specifically. I have seen like dog vests and stuff that have been treated, but directly to spray your pet, I'm not fully aware of and cannot say yes or no.
Mm-hmm.
I would not spray permethrin on a pet or on your skin. So in order for permethrin to work, it has to be dry. If it's wet, it's not effective, and it can't dry on your skin because our skin is always moist because we kind of sweat through there, right? So same principles would apply to your animals. You can spray like a bandana that they can wear. Like Ashley mentioned, they have vests that you can purchase that are already treated. But to directly spray a person or an animal with permethrin would not be advisable.
And just remember, cats, it is very deadly to cats. So make sure you keep away a wet product, or if you are spraying clothing, make sure you keep your cats away.
Okay. Tammy says, can you discuss the association with mice or different animals other than deer? I'm thinking deer get a bad rap with regard to the spread of the disease.
Yeah, deer get a bad rap because they are the final host for Lyme disease before tick can infect humans. But there are other host species depending on the stage and the type of ticks. Like I mentioned, small rodents are very common. White-footed mice have been known to be a interstage host for tick-borne illnesses, as well as other type of mice. We have a lot of different types of field mice and wild mice here in Minnesota. So white-tailed deer are not the only host species, but usually it is a small mammal. Those are going to be your most common host species for a lot of tick-borne illnesses.
Good enough. Michelle says, as long as a tick is removed in less than 24 hours from attachment, does that prevent Lyme disease transmission from happening?
Your risk of that exposure is lower, but does not eliminate. So, there's always that one case or two cases or, some small number of cases where the tick had been embedded for less than that 12 hours, where you could still have that potential to have that disease transmitted.
What time of year is Minnesota? Is there many adult and nips around? Spring?
Yeah, so I briefly touched on this early. Spring pretty much through winter. So like I mentioned in the DNR, we kind of do see tick bites kind of begin February, and we'll see reports pretty much through December. So it's not, and then, you know, with our weather that we've had the last few weeks, I would anticipate to see just you know, more tick exposures with warmer weather, less snow. We have seen ticks crawling on snow. That is something that can happen. You can probably find those pictures on Google or another, you know, web search. So as long as it's the temperatures above freezing, they can be active. But yes, spring and fall through winter are going to be your most common time for adults. Summer for that nymph stage.
Is there a product that you can use to treat your lawn? Mary wants to know.
There are products that you can treat. I don't have specific products, but if you go to your local home store, you know, Home and Depot, Lowe's, things like that, there are products that you can lay on your lawn that do treat for ticks and chiggers and things like that.
Okay, and Joel wants to know, is permethrin made from, oh boy, some big scientific name, the chrysanthemum flower?
I don't know offhand. Joni, would you happen to know? The
Chrysanthemum is a natural derivative. Yeah, it naturally repels insects, and permethrin is a derivative of the chrysanthemum plant.
Okay. Carol said, sorry if you said this and I missed it, but are there tiny babies on the ground nest? And if you had a dog nosing around the grass in the woods and coming face full of them?
That is possible. So like I mentioned, the females do lay their eggs in what is called kind of like a bomb, because there's just a huge cluster full. So when they hatch, they usually stay close to each other to begin that questing, where they will go to a edge of a branch, a leaf, to try to attach to a host. So it's not uncommon to come across a large bunch of them, whether your pet or yourself. And then have those become attached to you or start climbing around on you.
William's got kind of a long comment here, but a few years ago during deer season, when we had 70-degree weather, my son had a tick burrow into his skin. The deer he was field dressing had lots of ticks on it. I've never seen deer ticks on this property, but the tick that burrowed did appear to be a common wood tick. The tick was very small. He did develop an infection at the bite site and bullseyes. He then was treated with antibiotics but not tested as well. Any guess to whether what type of tick this was, located in northern Clearwater County? If you got the bullseye, would it be a deer tick?
Yeah, most likely.
It was mentioned to save any tick that was attached to the skin in case symptoms appear.
Mm-hmm.
What about proactively getting the tick tested for disease along with seeking prophylactic antibiotic treatments from a doctor rather than waiting for symptoms to appear?
Well, the best thing to do is, if you remove the tick and bring it to your doctor, in whether you have symptoms or not, at least they are aware. But to, begin treatment without symptoms, you could be treating for something that you might not have. Not all tick-borne illnesses have the same treatment plan. Not all of them are antibiotics or other type of treatment options. So, and like I mentioned, some of the tick-borne illnesses is just more supportive care, whether that's additional fluids, kind of helping them symptoms, not necessarily the treatment. So I would just advise personally, and I would all automatically follow, I'm not a medical professional, but to reach out to your public health, your county public health individual and your doctor for the best routes forward if you had found and removed a tick.
I think Benita and Jason were talking about the application of permethrin to your pet, and they say that's what Frontline or Simplicita is for, or Canine Advantix 2 is.
Yeah, there's multiple different products that are for pets. I would just contact your veterinarian to verify the actual application and what is best for your pet depending on exposure and things like that.
Okay, let's see if we've got anything else here that looks like we got through most of the questions on ticks. And I have been treated with doxycycline for Lyme's, and my dog has ehrlichiosis. And he's not showing any symptoms, so he doesn't need to be treated right now, but it's very common, you know. So I think we've got through all the questions we're going to have time for today. Thank you both so much for being here and answering questions and taking time out of your day to help us out. I just want to remind everybody that next week is episode 204, the Bluebird Recovery Project. So tune in for that and register for it if you haven't registered yet. Thank you again, Ashley.
Thank you.
Cassie, if you can take us back to the green room.